Hi, I'm Katrina and I will be presenting to you how the heart works. So we're going to start out with structure. So over here is the superior vena cava and down here is the inferior vena cava, and it brings blood back from your body to be oxygenated. It meets up around here, then it travels through over here and goes out of your pulmonary arteries. The pulmonary arteries are the only arteries that have deoxygenated blood inside of them. They travel to the lungs to get oxygenated, and then they go to the pulmonary veins, and then these are also the only veins in the body that has oxygenated blood, so keep that in mind. And from there it goes around here and then out of your aorta. Now the three arteries on top of your aorta, they go to your upper body, while the large part of your aorta down here goes to the lower body. Chambers and valves. Right over here is the right atrium, and this is where the deoxygenated blood meets from your vena cavas. Then they travel through the tricuspid valve, they go through the right ventricle, then out of the pulmonary valve and through the pulmonary artery, and they return through the pulmonary veins and into the left atrium, down the mitral valve, through the left ventricle, out of the aortic valve, and then to your aorta and throughout the body. The heart acts as a natural pacemaker, and it is the only organ with its own power supply, and it starts in the sinoatrial node, or the SA node, and then it sends electrical currents through the right atrium, and then it reaches the atrioventricular node, or also known as the AV node, and then the electrical currents travel to the AV bundle, and then it splits into two branches called the bundle branches, and the electrical current then flows towards the apex, where the Purkinje fibers over here, they split and they travel up towards the atrium, and this allows your heart to beat. There are several complications that a person can have with the heart, but a few are a heart attack, and this happens when there is plaque buildup in your coronary arteries, and most of this can be caused from an unhealthy diet, because most of the cholesterol we need is produced ourselves. So the extra cholesterol will flow through the bloodstream, and it can sink into the atrial wall, causing this sort of squishy inside and a little firm or outside of plaque. And this can cause hypertension because there is more pressure put onto your blood vessels, and as this happens, less blood can travel through the artery and deliver oxygen to the cells that it needs to, and this can starve the heart of oxygen, and then a dark spot can form on your heart where the cells are dying, and normally new coronary arteries can be produced to compensate for this lack of oxygen, but this normally takes 2 days. So if your blood accidentally scrapes the plaque and causes a clot, then even less oxygen will be getting to your cells, and that can be potentially fatal. And as your cells starve and burst, you lose 500 per second, and they can never be replaced. So it's imperative that if you are having a heart attack, you get to a hospital and take anti-clotting medicine, or before, you can also take blood thinners or aspirin to allow the blood to flow through more easily. Another heart complication can be ventricular tachycardia, and this is caused from abnormal electrical signals in the ventricles, and this causes arrhythmia because it interferes with your regular heartbeat from your SA node, and arrhythmias can happen to people with heart disease and healthy people, so no one is exempt from arrhythmias. It can happen to anyone. And this can lead to ventricular fibrillation. And what that is it's a very fast, irregular heartbeat because of the complications with the SA node and another cell that is beating irregularly. And to cure this, you need defibrillators, and this actually stops your heart, and it gives the SA node a chance to restart itself to get a normal heart rate.